A silent risk in your medicine cabinet. Most seniors live with pain, joint pain, back pain, headaches, or arthritis. The easiest solution: a common over-the-counter painkiller. One pill, and you're back to normal. But what if this small act of relief is actually silently increasing your risk of a life-threatening stroke? This may sound shocking, but for millions of seniors around the world, it's an unseen danger they face daily. As a brain doctor, I've witnessed patients suffer the consequences of something they believed was harmless, and by the time they realize the truth, it's too late. What is this painkiller, and why is it so common? The painkiller we're talking about belongs to a group called NSAIDs, non-steroidal anti-inflammatory drugs. This includes ibuprofen like Advil, Motrin, naproxen like Aleve, and some stronger prescription medications. They're sold everywhere, in pharmacies, supermarkets, even gas stations. People trust them. They don't require a prescription, and they promise quick relief. But just because something is easily available doesn't mean it's safe, especially for older adults. How NSAIDs work inside the body. NSAIDs work by blocking certain enzymes in the body known as COX-1 and COX-2. These enzymes produce prostaglandins, natural chemicals that cause pain and inflammation. So when NSAIDs block those enzymes, you feel less pain. That sounds helpful, right? But here's the problem. Prostaglandins also help protect your stomach lining, support kidney function, and regulate blood flow. So when they're blocked, your entire body is thrown off balance, especially your heart and brain. The dangerous effect on blood pressure. One of the most overlooked side effects of NSAIDs is their ability to raise blood pressure. Many seniors already have high blood pressure. When NSAIDs are added, even for just a few days, blood pressure can quietly increase. You may not feel any different, but inside your body, your arteries are under more stress, your heart is pumping harder, and your blood becomes thicker. A dangerous setup for stroke. Stroke risk from blood clots. The real danger lies in how these painkillers can increase the risk of blood clots. When blood thickens and pressure rises, clots are more likely to form. These clots can travel to the brain, block a blood vessel, and cause a stroke, often without any warning. This isn't just theory. Multiple studies have shown that NSAID users, especially older adults, have a significantly higher risk of stroke and heart attack compared to non-users. Research backing the danger. A major study published in the British Medical Journal examined over 400,000 people. The findings were alarming. Using NSAIDs like ibuprofen or diclofenac increased the risk of heart problems, including stroke, by up to 50%, especially during the first 30 days of use. That means just a month of regular painkiller use could sharply raise your risk of a life-changing event. For seniors whose bodies process drugs more slowly, this risk is even more severe. The false sense of safety with OTC drugs. Because NSAIDs are sold over the counter, people assume they're completely safe. But this false confidence is dangerous. Unlike prescription drugs, which come with detailed instructions and doctor supervision, these common painkillers are often taken without any guidance. People take them daily for arthritis or chronic pain without ever realizing they're slowly increasing their stroke risk. Seniors are at much higher risk as we age. Our kidneys weaken, our arteries stiffen, and our ability to process medications slows down. That means seniors absorb more of the drug, and it stays in their bodies longer. At the same time, older adults are more likely to have conditions like high blood pressure, diabetes, or heart disease, all of which increase the risk of stroke. Adding NSAIDs into the mix creates a perfect storm. Not just ibuprofen. Others are dangerous too. While ibuprofen is the most well-known, other NSAIDs like naproxen, diclofenac, and celecoxib are also linked to serious health risks. Some, like Diclofenac have even been banned in certain countries due to the dangers. But in many places, including the US, these drugs are still widely available and heavily used by seniors without proper medical oversight. Extra strength and long-lasting equals extra dangerous. Many painkillers are sold as extra strength or long-acting. These versions stay in your bloodstream for longer periods, putting constant pressure on your heart and blood vessels. For someone with weak circulation or pre-existing heart conditions, that extra exposure can lead to catastrophic consequences. Hidden NSAIDs in cold and flu medications, even if you're not taking painkillers regularly. NSAIDs are hidden in many combination medications, especially cold, flu, and sinus relief products. If you take one of these while also using a painkiller, you may double the dose unknowingly. This increases your stroke risk without you even realizing it. Medication. Interactions with common senior drugs. Many seniors take medications for blood pressure, cholesterol, and diabetes. NSAIDs can interact badly with these drugs. They can weaken blood pressure medications, reduce kidney function, and even increase bleeding if you're on blood thinners. These interactions multiply stroke risk, and most people have no idea. The dehydration factor. Seniors are more prone to dehydration, especially in hot climates. NSAIDs increase fluid retention and can worsen kidney strain when the body is already dehydrated. This leads to blood thickening, a dangerous factor that can make stroke even more likely. Real-life stroke warning signs if you use NSAIDs frequently. Be alert to the early signs of a possible stroke: sudden numbness or weakness in the face, arm, or leg, trouble speaking or understanding speech, sudden vision loss of balance or coordination, a severe unexplained headache. These may not seem connected to your pain medication, but they can be. And acting fast within minutes can save your brain and even your life. Safer pain relief alternatives for seniors. So what are the options for seniors who need relief from pain? Here are a few alternatives. Acetaminophen Tylenol, safer for the heart, though caution is still needed for the liver. Topical creams. Pain relief without affecting internal organs. Physical therapy and light movement, gentle exercise can ease stiffness and strengthen muscles. Natural remedies: turmeric, ginger, omega-3 south, and magnesium-rich foods reduce inflammation. Tips to lower stroke risk if you use NSAIDs occasionally. If you absolutely must take an NSAID, use only the lowest effective dose. Take it for the shortest time possible. Never mix with alcohol or other medications unless approved by your doctor. Monitor blood pressure during and after use. Stay hydrated and eat healthy. Anti-inflammatory foods. Schedule regular checkups to evaluate your stroke risk. This matters. Your life could depend on it. Every day, thousands of seniors unknowingly take pills that slowly raise their stroke risk. They don't mean to. They don't feel any different. But the damage is happening quietly until one day the brain stops responding. Speech disappears. Memory fades. Movement is lost. The painkiller they trusted becomes the very thing that breaks their independence or ends their life. What you can do starting today. Here's what you can do right now to protect yourself or someone you love. Review all your medications, including over-the-counter ones. Talk to your doctor about pain alternatives. Watch your blood pressure closely. Share this message with family, friends, and caregivers. Protecting your brain means being informed. Stroke doesn't care how old you are. It doesn't wait for a warning. And it certainly doesn't come with a label that says, caused by a painkiller. But it happens every single day. You have the power to lower your risk just by making smarter choices about what goes into your body. Pain relief is important, yes, but so is your life, your clarity, your memories, your independence. Take care of your brain. Treat every medication, even the common ones, with respect. Because when it comes to stroke, what you don't know can absolutely hurt you.